Hello, colleagues, and welcome to our monthly April 2022 session. We are starting slightly late as we fix the translation services, but you'll bear with us. We'll make sure that this runs for 1 hour, and we will start with a presentation and then follow with a question and answer session. We implore you to join the discussion through the chat space. Please share your questions, comments, and any alternative experiences that you may have on this topic so that we can then enrich the discussion. We will have concurrent language interpretation. That is what is being sorted now. And please, once that is sorted, please make sure that you are either on the French or the English channel. Do not stay on the off channel because then you will lose out on the interpretation services. Our speakers will slow down a bit to make sure that the translators can do their work very effectively. Colleagues, today we will be dealing with one very special topic. We know that international standards that guide quality management system development and implementation in labs require that when you're introducing a new test method or equipment, there should be method verification and or validation. However, the capacity and skills to undertake some of these critical requirements are not necessarily available in all labs. And in effect, this has its detrimental effect because then labs that should introduce methods that are suited for their situation may actually decline to introduce them if the studies for method verification and validation is not done the right way. But also the other loop side of it is that you can end up introducing methods that may not necessarily be suitable for your setting because then the way data is collected, the way it is analyzed and interpreted may not be right. And so in today's session, we will be sharing with us the Assay Verification. This is a product of a great public-private partnership between ASLM, US Center for Disease Control and Prevention, and Roche. And this web-based tool is designed to guide laboratories intending to introduce new test methods in designing, setting up, and analyzing data so that then they can meaningfully introduce new test methods in their situation. And so to help us go through this, we have key speakers that will be sharing with us the new tool. The first speaker will be Rito, in no order of preference, Rito Sharistava, and she is the Global Public-Private Partnership Coordinator at the US Center for Disease Control and Prevention based in Atlanta. The other co-presenter for today will be Dr. Denise Aini. And Dr. Denise has so many titles. I will just take a few for today. And I will introduce Dr. Denise as the medical partner for the Molecular Lab and Infectious Diseases Network. But she is also the Director Digital Health Solutions and Healthcare Innovations for the Medical and Scientific Wing Affairs of Roche Diagnostics. Allow me then hand it over to our two presenters, and there will be a third element who will be hovering between the two presenters. Join me in welcoming the two presenters, and Denise, please, and Rito, please take it on from here. Thank you very much. Over to you.
You're on mute, Rita. Rito.
All righty. Can you hear me now?
Yes.
Yes.
Thanks. So thank you, Francis, for that wonderful introduction. So hello, everyone. A very good morning or good afternoon to you, wherever you are in the world. Denise, would you please put up the slides as I speak? So Roche Diagnostics and CDC have enjoyed a good relationship via the Public-Private Partnership, or PPP, since 2012. My name is Ritu Srivastav, and I am the Global Public-Private Partnership Coordinator at the International Lab Branch, or ILB, in the Division of Global HIV and TB at CDC in Atlanta, USA. So Joni Zurawinsky, based in Switzerland, the Director of Access and Partnership, leads it from Roche. At ILB, under Heather Alexander's leadership, our team consists of Monte Martin, Clement Zhe, Goqing Zheng, David Bressler, and Shirley Letcher. Together, we coordinate with ASLM's Anafi and Pascal Ondoa to bring the fruit of our labor to you today. Next slide, please. So the latest Memorandum of Understanding for this PPP is undergoing clearance at CDC as we speak, with the shared common goals of strengthening lab systems and diagnostic networks for countries severely affected by HIV and TB. The MOU is focused to increase lab human resource capacity, improve local and regional capacity for waste management, optimize lab workflows, and optimize integrated diagnostic network structure. Next slide, please. Within the PPP, we have created two tools, as you can see here. The Waste Cost Assessment Framework, or the WCAF, as we lovingly call it, and the Assay Verification Tool. The WCAF is an Excel-based tool, was launched on February 8th, 2022 at this very platform, the ASLM Echo Session, and the tool is available on the ASLM website. And it has been piloted in 8 countries, and we are very thankful to those countries. WCAF was co-developed by CDC and Roche Diagnostics to be accountable as a responsible manufacturer for the waste generated by the viral load EID kits used in the PEPFAR-supported countries. We made it manufacturer agnostic by making it useful to calculate volumes of solid and liquid waste for all viral load platforms used in the country. WCAF does not give a direct benefit to Roche, and the CDC headquarters is also not asking for any data that is generated from the tool by the countries. But countries are encouraged to use the tool to support budget preparation for waste disposal across HIV viral load and EID platforms as part of the COP planning. So, but today's presentation is about the assay verification, which is a web-based tool created with the viral load team at ILB. And with that, let me invite Dr. Clement Zhe, who is the team lead for viral load and EID at ILB CDC Atlanta. Over to you, Clement.
Thanks, Ritu. Thanks for that wonderful remarks. So talking about the assay verification, which was jointly developed with Roche, that's the CDC International Lab Branch and Roche. So to put it back into context, this tool was developed for several reasons. First, countries were having difficulty doing their own analysis. Even taking, for instance, the WHO pre-qualification that is mostly being done either option 1, which WHO select a lab and then provide some of the basic capacity for the lab to be able to do analysis, or option 2, where the manufacturer selects a lab and then try to do the analysis. We've been facing challenges with most of these countries trying to do the analysis, and in most cases, our team, especially for HIV viral load and early infant diagnosis, our team end up doing most of this analysis, or all the analysis here in Atlanta. So we felt that there's need to really build that capacity. And the other key aspect of this is not only just for pre-qualification, even simple new assay verification or a new specimen type that needs to be done. Countries are having challenges doing this. And there are several reasons why countries have this challenge. They lack the expertise to do some of these analysis, and also the cost of some of these expensive softwares that some of the labs may not be able to afford, and also maintain the license. So this assay verification tool will help to, especially in the area of doing a probit analysis with even simple sensitivity and specificity. I know labs can do that, but doing a probit analysis which help you to estimate the limit of detection, most countries may not have that capacity. So, and this is an area that we've seen continuous challenge even within our PEPFAR countries, even lab that new lab that we are setting up. So this tool, we hope, is actually to help simplify that and create that needed capacity of countries to begin to do their own evaluations. And so the assay verification tool will support to streamline verification activities in new molecular assays lab. This is a web-based tool that will be launched today. And with that, let me now introduce Denise. I think we already had Dr. Denise, who is leading this assay verification with Roche. So Dr. Denise is the interim chief of Medical Partner Molecular Lab and Infectious Disease Network, and the director of Digital Health Solution and Health Innovation, Medical and Scientific Affairs. She will lead the second part of this presentation, taking us through the detail of this assay verification. Denise, over to you.
Hello, everyone. Thank you, Clement. Thank you, Ritu, and thank you, Francis, for the introduction. I'm thrilled to be here today, and I really appreciate the opportunity to speak with you guys, with all of you, about the assay verification tool. As the previous speakers nicely highlighted the why behind the need for the verification tool, but I just want to highlight that again. One of the challenges in the laboratory, and prior to my joining Roche, I was a laboratory director, and this was consistently a challenge, is the ability to verify an assay and get it up and going so that you can actually test patient samples quickly without sacrificing the quality of the assay verification. And so really this tool does the three things that Clement nicely highlighted. It allows for planning assistance, so that you can look at what type of experiments for verification need to be done. It allows the analysis of data once data is put into the tool through the web-based portal, and it generates a report that assesses the data and then also allows for the appropriate compliance sign-off and checks of the data analysis completeness. So there's really three key things that this assay verification tool does to meet the requirements needed for assay verification. I'm going to provide a demo today during this discussion, but I want to highlight a few key things before I go into the actual tool itself. So the assay verification tool within this collaboration includes HIV and other high burden diseases, which I will show you within the demo. But it really is designed to allow for ease of use in implementing new tests. And through this, it allows for the input of data, allows you to set up and understand what kind of analysis is being done, and then allows for the data to be analyzed and a report to be generated. And this just gives you a few screenshots from the site here on this particular slide. Within the assay implementation tool, we will be able to do multiple things. So in this tool, you can actually go in and review definitions of various terms for the specific performance characteristics that have to be verified when you bring on a new in vitro diagnostic molecular test. it follows the guidelines of a variety of regulatory bodies, including the CDC. We work closely with them to ensure that these verification terms fit in line with what their expectations are for verification. It allows the input of data that generated from a verification study, as well as Clement mentioned this, if there's additional sample types, you can actually go in and add in more data or assess more data, and it will automatically calculate and produce graphs that are then generated and documented within a PDF formatted report. And again, this can be saved and signed off for the laboratory's records. It can also be shared electronically in the event that you have to share some of that data with a colleague or back with the CDC. In this particular tool, as Ritu mentioned, it's a web-based interface, and this shows the front screen here on the left side of the screen. And it has capabilities, which I will show you in the demo, for folks to register. And once you register, you will create your own unique username and password. And then it will take you into a variety of pages where you have specific capabilities of selecting what pathogen and what test and on what system you would like to do the data analysis for. So I think this actually shows you the results here in this particular tab, but I think it's better seen through the actual demonstration. So I'm gonna click here and I'm gonna hope, yep, so success so far. I'm going to log in. And once you log in with your unique username and ID, what you will see at the top of this screen is this symbol up here. This symbol will be on every page, and at any point you want to return back to this front screen, you will click on this particular symbol within each page. This is your front page once you log in with your unique username and password. And on this front page, it restates what the purpose of the tool is. It provides an overview of what the tool is designed to do. It gives you some information on how to get started. And then you also, in the event that you have done this before and you want to come right in and go to where you've been before, it has some few links to jump to specific places. Before I go into the actual tool, I want to highlight that in the event that when it's launched as of today, you will see inside the tool that there is this data analysis tool demo. This link is here, and the link is also down at the bottom of the page. If you click on that, it will take you to a recording that walks you through the demonstration, very similar to what I will show you today. So there is the opportunity to re-see a demo before you begin utilizing the tool. The other two things above it are qualitative and quantitative test parameters and definitions. In the requirements for assay verification, both the qualitative and quantitative tests have different requirements for what needs to be verified when bringing on a new test. And so because of that, we separated them out so that you have access to seeing what are the performance parameters that I have to verify and what are each of those definitions. And so I will just click on one just to highlight what that looks like. And so you can see the precision, what's the objective, it gives you a definition, how it's performed, and gives a variety of references where this definition was procured from. And it goes all the way through the different performance characteristics. So as I mentioned before, I'm going to go back to the home page here, the front page. And in addition to the test parameters and definitions, you also can go in and edit and look at archive tests. So once you have input data and you've analyzed that data, it is automatically archived. And so you have access to go back in and review that data at an additional time. And you can go in and make edits or adjust it, and we'll always track those changes through the archiving process. So let's get started. So when you want to start, you would say, click this button, select pathogen, and test for validation or verification. So we're going to click on that. It will then bring you to this pathogen and test page. And at the moment, this pathogen and test page includes HBV, hepatitis B, hepatitis C, HIV, and HPV, human papillomavirus. And so if you say, I want to look at HIV, and I am currently going to be verifying this test on, let's just say, the COBOS HIV 1 for use on the 6800 system, then you're going to click next step. In this particular instance, I'm going to do the full verification. So I need to do linearity, I need to do precision, accuracy, limit of detection. I will also do a probit analysis. Clement mentioned this as one of the key things that needed to be included, and we've included that here, and method correlation. The one thing I want to point out is that if you highlight each one of these or scroll over them, it does pull up the definition and information that is included in the test parameters and definitions. So the benefit of this particular page of parameters and definitions is you can pick all or you can pick one. So if I want to do all of them, I'm going to select with my radio button here on the left, all of the performance parameters that I'm going to select because I'm going to perform a full verification. And then I would hit next step. And then it's going to take me through a testing setup process. It's going to ask me about what am I going to do for linearity? I want to do it in one batch size, or I want to do it in multiple batches. What's my input? So international units or copies per ml. You go through this entire process and answer all of these questions. And I'm going to show you this in an edited set of data in a minute. But it walks you through limits of detection with probit. You define how many concentrations you're going to look at, what's the maximum amount of replicates per each concentration. And then for your method correlation, it allows you the ability to put in what are you comparing this new test to? Your previous method, a set of archived samples. It allows you the opportunity to write in here what it is that you're doing. So let's just say that I've selected, I'm going to hit the next step. And then it's going to pull up all of the batches that you need to put data in. And I just want to show you that if you open this batch number 1, it sets up just like an Excel spreadsheet would. And you can then, from the data that you have generated on your system, you can then copy from an Excel spreadsheet right into this particular spreadsheet. The one thing I would like to point out here is that you'll notice that these buttons here are blue. Until you save, these buttons will remain blue. We had to go through this a few times. My biggest point of feedback on this particular slide is always save. So you put data in and then you hit save. It will then turn this into green and with a checkbox. Okay, so I'm going to show you some edited data and walk through the entire process due to our limited time today. But I want to show you what the data analysis actually looks like. So this is the archive test. I know the name of my test, so I'm going to search for it. And then I'm going to go in and hit edit. And this is one that we did for hepatitis B. It was on the 6800 system. We went through a full verification for this. So all of the different parameters have been selected. We did the appropriate testing setup. So we're going to do one batch of linearity. We're going to do 5 days of precision. We're going to test one batch per day. We're going to do 3 levels per day. And so we'll have 3 levels per day of each concentration. We are going to use accuracy data from the precision data. So the data that we generate from up here will include our accuracy data. We're going to do limit of detection, and we're also going to do a method correlation. So I'm going to hit next step. See if it'll go for me. There we go. A little slow. Okay, so the batch is brought up, and I'm going to highlight a batch here. So all of our batches, the data has been put in, it's been saved. The batch, there's 5 days of precision, so those batches have been put in. Each batch has a different set of data, and those have been saved. So as you go through and you add in all of the data, you'll be able to see it there. Let me move this. Okay. And once you complete all of the data input, you then hit next step. In this particular page, it allows you to put in all of the account information or your laboratory's information, whether it's the testing name or the institution, address, anything that you actually need for the requirements that you would want to be able to go back and see, lot numbers, what quality control material you're using, the date that you performed it, what instrument and serial number, because sometimes people have multiple instruments and they want to know which instrument this set of data is from. It allows for appropriate troubleshooting in the event that it needs to be done. So once all of that information is put in, then it will then bring you to the results. And so the account information is led up on the top. The linearity results follow, and then the subsequent parameters follow through. So you can see there's the linear regression plot shown here for the linearity assessment. And again, on the left side of the results page, it tells you exactly what this is and why it's being done and how it aligns to assessing the specific performance characteristic that we're looking at. So you get linearity, you'll get a table for precision, along with the calculations of the percent CVs and the total CV. And then you get a look at the accuracy results. As a reminder, we use the precision data to look at accuracy. And then the limit of detection, which we had 100% detection. So this is your data table. And then this tells you, did I have 100% or did I meet the minimum requirements? This says yes. And then you have your method correlation data. And the method correlation data is presented into 2 graphs. It's presented in a linear regression, and it's also presented in what we call a Bland-Altman plot to show you the differences between the data set in 2 different vantage points to really show you how linear you are between your new method and your current method, and what, from an accuracy perspective, the data looks like. So after every performance tab or data set, there's this print or save to PDF. So if you click this, and I'm not going to do it for this particular demo, but in the video it is done. If you click this, it will then open up a box, and you can either print or save the PDF. And the PDF looks exactly like what you see here in the results page or the results tab, but it is just put into a PDF file. Okay, so the one last thing that I would like to show in this particular demo is the quality control step. So a lot of times we want to start looking at, and the data was not put in, so my apologies, but a lot of times in the data set, you want to be able to look at control monitoring and see how it performs. In this particular tab, which is at the very end, it allows you to, if you put your control data into the table, it will then plot all of this information using Westgard rules and Westgard analysis to plot the control material and give you a beginning look at how your controls are performing on your system. And that just gives you extra confidence in the data that you've procured within your assay verification. So I'm going to go back to the front here again. And I'm just going to remind you that this similar, but in a little bit more detail, is included inside this verification tool under this CDC ASLM data analysis tool demo. So I encourage you to go and watch it multiple times, because if you're anything like me, I need to see things at least 2 or 3 times before I'm like, okay, I think I got it. This tool, this demo video is available for you. So I'm going to go back to our slides and talk about how do you access the assay verification tool. So this is actually located now, as of today, on the ASLM website in 2 places. So in the Diagnostic Evidence Hub, which is shown here through these pictures, and it's also included on the ASLM website in the Resource Center directly. So both of these places within the ASLM website will take you to the web link for the Assay Verification Tool, and it will take you to this home page. And for first-time users, this register for the validation tool is down at the bottom. You will just click that, create your registration, and then you will then have your username and password created, and you'll be able to access the Assay Verification Tool. So I'm sure there's probably a few questions, and I believe we'll have the opportunity to take those. But where do you go for questions to support? From the CDC, it will be Clement and Goching. We've been working with them extensively with this tool. And then also from ASLM, it will be Adisu. So again, thank you so much to ASLM for supporting and hosting this tool and making it available for the wide use. I'm super proud to have been part of the creation of this tool and to see it be utilized for assay verification across the board and being able to get quicker without sacrificing quality to testing patient samples. It's a proud moment for me, so thank you.
Thank you very much, Denise, and everyone. What a session, what a tool. And because for colleagues who have gone through supporting labs, be it mentorship, be it assessments, and you look at how verification is handled and how you can explain it for labs to be able to pick a few parameters and in a valid way, be able to deliver on their verification requirements is not as easy. And so this tool just comes in at the right time to support the drive that labs should then be able to meet this requirement among other requirements in the implementation of their quality management system. But before I say so much, I would like to note again that we've had some trouble with interpretation services today, and our sincere apologies to the French colleagues who may not be getting the concurrent language translation happening. We hope that we can then have the recording translated and then put on our online resource center so that you can as well benefit from this very important session. We have questions coming through, and colleagues, please keep them coming. We still have some time to deal with questions. The first question, I am sending it out there, and Ritu and Denise, you can decide on who takes it, but Innocent is asking, is the tool available offline?
It's web-based, so you would have to have access to the wide web.
Thank you very much. Clear. Now, do we need to import? This is a question coming from Dominic, and Dominic is asking, do we need to import data from the instrument, or there is a direct connection between the instruments and your web-based tool should somebody decide to use them?
So I would love to say that there's a direct connection. That would be maybe a future endeavor, but currently you have to pull the data from the instrument and then you upload it into the tool for the analysis. And I can work with both Clement and Goching for a standard spreadsheet that you can put the data into that then allows you for a copy paste right into the data analysis tool. It's not, once you do it multiple times, it becomes a little faster. But yes, I think ultimately it would be nice to have a direct connection, but as of today, we do not.
Okay, thank you, Denise. A few more questions coming through, and please keep them coming. Estelle and Sunday are asking, RDTs are used widely in most locations, countries and sub-country levels, the district and facility levels. Now, is this tool applicable for verification of RDTs? Rapid diagnostic tests, sorry for putting it in short.
So in my opinion, the parameters that are required don't change. What you do for a parameter for linearity or precision or accuracy for a molecular diagnostic test is the same across the board. So it can be applied to a variety of things in my mind. But this tool was actually developed, in conjunction with the higher volume, higher throughput molecular diagnostic assays. But that doesn't mean that it can't be used for, the RDTs as you mentioned. So the parameters are the same, the requirements for the parameters are the same. And so if I were using a different instrument, I would still do precision, accuracy, linearity very similarly, regardless of the instrument, especially if it was a molecular diagnostic test.
Just to follow on from there, Denise, and because we've seen the instruments that are listed, but also the conditions that you've listed, about 4 diseases, and I know that there
Yes.
is room for expansion.
Yes.
So what is the room for flexibility here, and when might that happen? So for now, what is available is only the listed instruments and the listed conditions. Anything outside that, how does it work out?
Yeah, I will have to ask Clement to comment on what the future capabilities are.
Thanks for that question. I think that's actually the next phase of this instrument verification, which our team working together with ASLM, we're going to be further customizing this to add more instrument, make it actually instrument agnostic. So basically, you can basically run your test, and as Denise clearly put it, just copy that result and then put it into the Excel spreadsheet of the tool, and then you do analysis there. So that's the next phase that will now that it is being launched, we're working now with the ASLM team to do that customization. Over.
Thank you, Clement. Yeah, Damali is the next person asking a question, and she is asking, just for your comment on data access, who is able to access the data that we are putting on this web-based tool? Is it everyone, or it remains on the account of whoever is doing the analysis?
So I'm happy to answer that. The way that we've built this is there's levels of administration access. So if you were an administrator of the tool, which usually, like Clement and Goching would be that, they have visibility to all of the data that is put in. But if you're just a user, a basic user, you would have access to the data that you've put in. There's also the potential for a middle type of user. So what we're calling a group user is they would have access to the data that they put in, but also a defined set of other sets of data that we can include in the capabilities of the administration site. So really, ultimately 3 levels. So a user, they would only have access to the data that they put in. A group user, which would be their own data plus data of defined other users. And then an administrator, who's usually the person that's managing the tool, making sure it's working right, doing all the quality control checks. They have the capabilities of seeing everything. So the demo that I included today because I'm an administrator, you have the accessibility to see all of the data that's been put in.
Thank you, Denise. What are useful information? Now, our next question is coming from me, but also from a colleague that I will name a little later. So with this, I know that quality management system requires that we define our procedures and then follow those procedures. And so labs that did not define the use of this tool as part of what they would be doing in method verification will definitely have to fall back. But what is the transition plan for those who may want to take on this tool as part of what can support their method verification? And next to this is the aspect of training. I know that we can jump in, go to the website, try to do whatever it is that we can do with the tool and learn a few tricks here and there. But could there be a systematic way of, other than the launch today, of training those who may want to adopt this tool as part of what they would then use for their method verification?
I'll let Clement answer that one too.
I don't know if I get your question clearly. So if you're asking in terms of training, I think as we'll continue to provide ongoing training for those that need additional training. They will believe that the tools that Denise has put out there clearly is self-explanatory, and if additional support is needed by a lab or a countryside, we can provide that additional support. And I think this is where this is the bridge and working relationship with ASLM, which we are handing this, leaving this tool there, so that if there will be the monitor and evaluation of who is using this tool and what support they will need. So I think that's an aspect that a building function that we've added onto this tool, that we should be able to know who is using it. And if they need additional support, we can provide that. We're going to be monitoring that and evaluating how the tool is being used. So again, we believe within, I know you asked about the length of time that will take to get the next phase ready. I think we believe that within a year or so, we should get the next phase ready. So right now we have phase 1. I believe that phase 2 should be ready in about a year time. That will allow other platforms to be added, other assays, because what we just listed here are the few molecular tests. But we hope in the future we'll have it open for other tests that are needed. Over.
Thank you, Clement. Thank you very much. Now, there's some questions that are coming through, but we may already have answered them on the flexibility with other instruments and other tests. We can, at the end, do a wrap-up on that so that it is clear to everyone who may have missed some of those questions. But one more question here, and I hope to get additional questions coming through. Are there associated costs?
I think there's somebody's hand also has been waiting. I don't know if there's somebody whose hand has been up for some time now.
Manuel, I know that Emmanuel then puts questions on the chat. So I was imagining that we've dealt with Emmanuel's questions. But Emmanuel, if you're done, then you could put your hand down. If not, then leave it up and we'll get to you at some point. The question on cost, are there some costs associated with accessing this tool other than just data need for anybody who may be interested?
I will have to, yeah, Clement. These are for you, Clement.
Sure. No, there will be no cost associated for any lab using this. Again, as we talked about some of the challenges that labs are facing, trying to buy and maintain those licenses of software to maintain. Here, they'll have this access to this tool for free to use it in their lab. I think the part of maintenance is what CDC will be working with ASLM to maintain this tool on the ASLM web portal. Over.
Thank you, Clement, again. Now, I have Musama asking on the verification report. I know that we've shared some of the charts that come through when you've done your data analysis and the output that you get, but she is asking, is there a generic report that then you feed into when all this is done and dusted to then be approved or reviewed by the authorized lab person? That aspect needs to come clear from Sama, I guess.
So I can just describe the report that comes out is in a PDF format. And at the top of it, it's set up so that it is a formalized document so that the account information is at the top. So the lab's information, who's the contact person, and then the data and data analysis. So the tables and all the information come after it. After each of the performance characteristics that you have verified, there's a signature line for both the lab director and the technologists that perform the results to sign off to show that they've checked the data and that it meets qualification requirements. So each stage of the verification in the report has a signature line to ensure that compliance and quality control. And then that report you can either do that electronically or you can print it and then sign it manually and then scan it and upload it, however. But the report is designed to meet all of those requirements.
Thank you. Thank you very much, Denise. I have a general question from Charles. Charles is asking, what is the greater good of using the tool? The greater good. What a general question.
I mean, I'm a little biased. You want to answer that?
Again, Francis, as you started with quality, I think the whole essence of this is to improve quality of the data that are being generated. We've seen, I mean, from all the challenges that we've been facing, I mean, from pre-qualification or just a simple introducing a new assay, lab doesn't have the capacity. So the whole extent of this is to provide simple tool that labs can use. You don't need to be a statistician in order to do your own analysis in your own lab. So here is tool being delivered right inside your own lab that you can do your own analysis. I think going forward, we're trying to simplify the process. I think to us, this tool is highly needed. I mean, we've met with colleagues from WHO. We've been trying to figure out how do we standardize a process that everyone can do analysis and get the same results. So here is one tool that can really help to address that.
Thank you very much. I entirely agree. And like I indicated, what a useful tool. And for colleagues who are starting their quality management systems implementation, and when you do your documents and everything else, then you get to those little very complicated data analysis bits and pieces on method verification, validation for those that develop new methods in their own labs, and it gets very, very tight. And having such a tool is such a welcome move. We are almost coming to the top of the hour, and I would want us to do the wrapping up, but I will just want to make this statement for the benefit of our lab colleagues out there, of course, managers as well. This is a new tool. If you choose to develop, use it in your lab, know that you will have to modify some of your lab procedures, some of your policies to accommodate it. Otherwise, taking it in might create new non-conformities for your laboratory. And we wouldn't want to be a reason for creation of additional non-conformities in your lab. But it is such a useful tool, and it will make life easy for everyone. And it will take away the thinking that you have to have a few people who can do method verification in the lab. You can have everyone actually doing it in their sections. With those, allow me ask our colleagues to do a wrap up. I'll start from Innocent is asking a question and we do not have a lot of time to do that. Innocent, your question will be answered through our routine sharing of pending questions with our presenters. I will make sure that that gets posted to our online resource center. Now, can I get to my presenters and we wrap it up? And I will start with Clement, your closing remarks.
Well, thanks again to the ASLM team for allowing us to share this Assay Verification Tool. I think this tool will definitely help a lot of labs to address some of their ongoing challenges and the lack of capacity, HR staff, statisticians. We hope this tool is here to stay as we will continue to improve it. This is just the first version. We hope that the next version will address a lot of the questions that have been raised here today. So look forward for the next version. Thank you. And thanks again to Denise, who actually led the development, and also thank you for giving the demo today. Thank you. Bye.
Thank you, Clement. Denise, over to you for your closing remarks.
Thank you, Francis, and thank you, Clement, and thank you all for being here today and for listening. And I'm excited, and hopefully you are too, now that you've seen the tool and your level of interest in utilizing the tool has gone up. We know that this will help improve that, the speed to being able to verify without sacrificing the quality. And again, I appreciate ASLM for their support in hosting the tool, and also to the CDC for being fantastic partners in all of this. So thank you.
Thank you, Denise. And finally, Ritu, for your closing remarks.
Thank you, Francis. And actually, thank you to the entire team, which includes ASLM, which includes Roche, Joni in particular. And really, through the PVP, we hope to bring more such tools. And we would love to have your feedback to understand whether this is important, has it been useful, and what else can the PPP do to support you in your journey towards accreditation. Thank you.
Thank you very much, everyone, for spending the last hour of your time with us. We hope that this was such a useful time spent with us. On my side, I cannot underestimate the value of this tool. We look forward to version 2, which will expand the instruments that will be used, and also the test methods and conditions that can be covered. But I know that you can, for now, start doing something so that when we get the second version, we'll have the skills required to run through. Again, until we meet on Thursday for yet another very exciting session from me and the ASLM team and the presenters from USCDC and Roche. Goodbye for now, and enjoy the rest of your day, evening, or night. Thank you and goodbye.